All right, everybody. I am your host, Dr. Lauren LaRose. I'm a board-certified child and adolescent psychiatrist and adult psychiatrist, and I have the pleasure of speaking today with Dr. Rosalie Greenberg. She is also a child and adolescent psychiatrist like me, um, and I found her by listening to a podcast called Demystifying Pans and Pandas by Dr. Nancy O'Hara. And as some of you know, one of my children has PANS, and it has been my mission to increase awareness and education about this condition. And, at the same time, I'm learning a lot too that helps my son and my patients. So when I listened to Dr. Greenberg's episode with Dr. O'Hara, it was very enlightening. Um, the things that she has seen in her practice and her career with regards to pediatric bipolar disorder and finding out that a lot of these patients actually have neuroinflammatory conditions. So we are just going to pick Dr. Greenberg's brain here and ask her a ton of questions about this because it is so fascinating. So Dr. Greenberg, can you just kind of give us a, overall picture of like how you came to where you are now in your career?
Sure. I trained way back when the dinosaurs were around, at the late 1970s, 1980, at Columbia. And I was with the people who were the pioneers in mood disorders in children, as well as ADHD and other things. And what happened is, so that made me very biologically oriented. When I went into practice, I worked at a psychiatric hospital, outpatient, and I just saw a lot of different kids. And, I was able to pick up more mood disorders than many of my colleagues, but that's because that's what I was trained to see.
Right.
Then you get towards the 2000s, and suddenly everybody was talking about bipolar kids. I had seen my first bipolar kid during my training in 1980, and he was classic bipolar. So I knew they really existed, but they're not so common. But there was a lot of research at that point looking at is bipolar a disorder in kids, and it wound up being very controversial. But I wound up becoming a specialist in it. Once you become, people think you're a specialist, they all come to you when you become a specialist if you weren't before. And so, and these kids are always very hard to treat. Bipolar kids are among the most difficult, because they can be dangerous to themselves and others. They may be psychotic, and stabilizing their mood can be very difficult. So at around 1998, Sue Sweeto at the National Institute of Mental Health started talking about pandas, which was basically after a strep infection, a youngster could develop an encephalopathy, and that would affect certain areas of the brain, and so you could get the sudden onset of tics, what do you call it? Obsessive compulsive disorder. The parents will tell you, the kid woke up the next day. I don't know who this child is. It's not my child.
Yeah.
And there would be a lot of other symptoms going along with that. So that was pandas, because the idea being that that was secondary to a strep infection. Okay. With antibodies, the immune system being misdirected and affecting certain parts of the brain. Okay. So I have many difficult kids, but there was one kid that was really hard. And I knew he had been hospitalized 3 or 4 times the previous year. And I knew if I didn't come up with some miracle, he was going to go to residential placement. He was around 11, I think. And, I asked his mother if he ever had a strep infection. And she said, no, my other kids do, but he doesn't. And then I got his streptococcal titer. The ASO was like 800 something. Well, I said, wow. You may not have seen it, but I know he had it. His body was
Yep.
telling us that.
Yep.
Anyway, so I referred him to a colleague that I work with that treats PANS and PANDAS. And it took around 3 months. And then this kid came back into my office and was like a changed child. He was
Wow.
leaning on his mother. He's saying, you know, Dr. Greenberg, I think I'm going to get all A's. I really want to do well in school. I never saw anything like that in my entire life.
Wow.
Okay. And so that was kind of like, whoa, what am I seeing? I've never seen this before.
Yep.
And that's how I got even more into PANS and PANDAS and this whole idea of infections.
Mm-hmm.
And as time went on, people talked about PANS, which is the idea that there's some insult or something that triggers the
Right.
abnormalities, psychiatric abnormalities. But it doesn't say what the cause is in the name. So
Right.
just like, PANS is like cancer and PANDAS is leukemia. It's a
Right.
type.
Right.
Okay. So anyway, like I said, I have the selection process is everybody who comes to me, not everybody, but the majority, the question is a kid bipolar?
Right.
So I started testing my newer kids for PANS and PANDAS. And, I get a lot more mycoplasma than strep.
Mm-hmm.
And then I learned the ticks carry mycoplasma.
Mm-hmm.
And I thought, wait a minute, I guess I better learn about ticks. So, and that is really what happened. So
Yeah.
then I started entering the world of tick-borne illness, which is crazy beyond belief. And the tests are not good. There are a whole bunch of pitfalls.
Yeah.
But it also really helped change my approach to psychiatry, medicine, and the way I look at mental illness.
Yeah.
Because New Jersey is one of the top, 3 states in terms of having Lyme disease.
Right.
Okay. But we also have, Babesia and Bartonella and these other infections.
Mm-hmm.
So I wound up discovering all these new types of bacteria, parasites, and whatever, and saw the relation to psychiatric symptoms.
Mm-hmm.
So for me, it's still, I think, a bit puzzling that
Yeah.
it's very hard to find a doctor who believes in PANS and PANDAS.
Yep.
Because once you see it, I don't know how you go back.
Nope.
Okay. Who ever heard of, part of it, people think the brain is like separate from the rest of the body. It's just
Uh-huh.
not.
Nope.
Let's get real here. It's the same as your stomach. It's the same as, other parts. And I say that in terms of what happens when you get these infections, when you treat the kids, especially with the tick-borne infections. You can and you treat them with, let's say, an antibiotic to kill the bacteria. What happens is you get an exacerbation of your
Mm-hmm.
symptoms. Well, if you have an arthritic knee, it's going to be even hotter. It's going to hurt more. It's going to be impossible. And that's
Right.
part of the bugs being killed off and whatever toxins are released, whatever. Well, if you manifest an illness in the psychiatric way, your bad temper is going to become a horrible temper.
Right.
And so then you will become more off the wall.
Mm-hmm.
And maybe trying to beat your brother up or your mother up or whoever.
Right.
So, but that's a whole different way. Whoever heard of, okay, go home, give your kid ibuprofen and call me in 2 hours. Tell me how he is.
Uh-huh.
And the kid's calmer.
Yep.
Not always. It may take a few doses.
Mm-hmm.
This is not the psychiatry I learned, you know? Or so suddenly, the kid was very angry, and then he became less angry. Then he became more obsessional. It was fascinating to watch the
Yeah.
different things, psychiatric manifestations. of this physical illness. And so for somebody not to believe in pans and pandas, we're on the threshold of just major change in psychiatry and neurology and infectious disease. All of these things are really overlapping. And that's
Yeah.
part of the problem because people work in a silo.
Yep.
They don't talk to each other.
Yep.
I don't know. His joints hurt. Well, I'm a psychiatrist. What do I know? I mean,
Right.
come on. The body's connected. Let's get
Yep.
real here.
Yep. Yep.
And so it's been an amazing, eye-opening experience. But it's been very, very difficult to have regular practitioners get on board with this.
Yes.
Okay. It's like they say about newfound knowledge. At first everybody says, oh, that's ridiculous. Then they say, well, maybe. And then they say, of course, we all knew that.
Yeah. Yep. Yep.
And that's where we're going with this because there's no
Right.
question. The things I
Right.
have seen, I had never seen before.
Right.
The changes. I mean, to see a change in a kid's personality.
Yep. Yep. So you published a paper where you actually like gave some numbers, percentages of these patients that ended up having tick-borne illness. Can you tell us some of those?
Well, as I said, I was known as a specialist in childhood bipolar disorder. So I reviewed 37 cases in my practice, and that all had I had them get testing for tick-borne illness. And standard testing like LabCorp and Quest, you got a 50% hit rate that maybe you'll get it.
Right.
They're really poor. So, but like I said, I was in New Jersey, and my newer patients, I kept finding all these tick-borne illnesses. So I went back and looked at kids that I've been treating for 10 years who were bipolar. And they were positive for tick-borne illness.
Yeah.
At which point I thought that I don't even know how I tell anybody this because I don't think they're going to believe me. It sounds so crazy that the majority of my kids were. Well, anyway, in this review, I reviewed 37 kids, and more than 3/4 of them had positive testing on specialized tick-borne illness testing, and it was confirmed by a physician who specializes in tick-borne illness.
Wow.
So it wasn't just tests.
Right.
Because as I told you, the tests can be very iffy depending on what test, what day, and what your body's doing.
Right.
But also a clinician to take a look. It's nice to positive test, but does that really mean anything? And for them to confirm. So more than 3/4 of my bipolar kids were positive for tick-borne illness.
Yeah.
A certain percentage had 3 different infections, including Bartonella, Babesia, and Borrelia, which is Lyme. And all of those interact and are going to affect how treatment occurs because in terms of what symptoms you're going to see.
Right.
And the problem is people talk about Lyme being so terrible. But that was just what we knew about. We didn't know these co-infections were there.
Right.
So that's something that needs to be teased out and slowly is being teased out. But there's a lot more that needs to be known.
Right.
So a lot of people, though, refer to the illnesses as Lyme. And it really may not be the Lyme infection. It may very well be Bartonella.
Right.
That's a bacteria. Actually, most people know it as cat scratch disease. You can get it from a scratch of a cat or a bite or whatever. And people would always think, well, that's self-limited. It's going to go away on its own. You don't treat it. But it is actually the third, I think, most common reason for fever of unknown origin.
Oh, interesting.
Yeah. Okay. So, if you have a persistent one, something to think about. Okay.
Okay.
And Bartonella is an interesting bacteria because it's carried by multiple animals. Okay,
Mhm.
you get it from mites. Uh,
Mhm.
Actually, it's still debated whether or not you can get it from ticks.
Oh.
Yeah, you can get it from fleas. You can get it from lice.
Huh.
Okay, so you can get it
Interesting.
from many, many different things,
Okay.
and and that complicates it too because
Yeah.
you will have people who are infected that may not be manifesting symptoms.
Right.
I happen to be one of those.
Really?
Well, I kept getting positive tests on my patients, and they're little
Uh-huh.
kids. And as you know, it's really, you hate sticking them with needles a lot. Okay.
Yeah.
And yet, to get these tests, they're going to need to
That's what you
get
have to do.
stuck. So I got a lot of
Mhm.
positives. And for Bartonella. And I thought, well, wait a minute, maybe it's just false positives. So I
Mhm.
tested myself, used a different name, and I had a positive titer.
Huh.
So I called up Ed Breitschwert, who's Mr. Bartonella, and he was the head of the lab at Galaxy. And I said, Ed, what is this? I'm positive. He said, look, go back, do it again, do what we call a triple draw. 3
Okay.
days in a week.
Uh-huh.
Okay, I'll cross over a week. And then we'll test it. We'll test it for PCR and look at titers.
Okay.
PCRs were negative, but my titer was even higher. Okay, this is ridiculous. I decided. Okay, um, so I happen to be working with this dermatologist. What is she? Well, she's a PhD in dermatopathology.
Okay.
And she had looked at the stria, the stretch marks, on a
Uh-huh.
few of my kids. And what we found is that the Bartonella was present, it was denser in the stretch marks, but it actually was in the regular tissue that
Huh.
wasn't red, blue, or
Right.
stained. Okay.
Right.
So I said, okay, let's biopsy me and see what I got. On the idea that hopefully that would hold true if I had it.
Right.
And it did, and I got to see the Bartonella stained in my tissue. So
Wow.
that makes me have tremendous respect for that test.
Yeah. Yeah.
Okay.
Wow. That's amazing.
Well, I mean, I had the same experience, or similar experience with the Igenics lab. I had a lot of patients that were positive for Babesia, which
Mhm.
is a parasite similar to
Okay.
malaria.
Okay.
Okay, just not as bad, but not great either. So, and the test, I had a lot of positive, what's called Babesia fish, fluorescent
Mhm.
in situ hybridization.
Okay.
And to get a positive fish, you have to be able to identify at least 3 Bartonella's organisms in 3 red blood cells.
Mhm.
Okay, so this is, anybody can count, but you have to see 3 to be able to say it's a positive fish.
Right.
Well, and one of my patients, came back from seeing whoever the clinician I sent them to was and said, the person said, yeah, I don't even order that because you never see those positive. And then I look and I have like 17 positive.
Wow.
Well, wait a minute. I mean, what is going on?
Yeah.
Talked to the head of the lab, Dr. Shaw, and she reviewed all the cases with me and she was surprised.
Wow.
Because they really were. Like I said, this isn't like going by titers or dilutions. It's using your eyes and seeing. If it's there,
Yeah.
it's there.
Yep. Yep.
So all these types of experience made me develop a lot of respect for these bugs.
Yeah. Yep. So when you now like looking back at all of these patients that you saw,
Mhm.
decades ago that were diagnosed with pediatric bipolar disorder that you treated for pediatric bipolar disorder, are you like thinking now, is
I'm
it
thinking
possible they really had?
I'm absolutely. Well, I'm thinking
Yeah.
I'm confused.
Yeah.
It's, and I had this discussion with the mother recently whose child I treated she's in her mid-20s now, and I treated her when she was 8 or 9, and for a number of years. And what's interesting, and what I found in my patients when I looked at them for the study, they're all, or not all, but the majority have family histories of mood disorder and
Mhm.
alcoholism and anxiety
Mhm.
disorders. And all of these things that we see go along with bipolarity and mood issues.
Right. Right.
Also, there is a high number of individuals that have positive family histories of autoimmune disorders,
Yep.
rheumatoid arthritis, lupus, psoriasis, Crohn's disease. Okay.
Mhm.
And studies have shown some association of these types of diseases, some of the rheumatologic diseases like lupus, dermatomyositis, associated with depression and mood issues.
Right.
So, basically, so this all winds up overlapping, and at this point, I think the DSM system is the best we've got, but it's definitely far from good enough.
Yep.
Okay,
Yep.
descriptive, but it tells you nothing about causality.
Yes.
And the psychiatric symptoms, they're like the final common pathway, the end
Mhm.
place of
Right.
many of these infections and insults
Right.
and whatever happens. But the causes can be very different.
Yes. Yep.
And so it just makes you look at psychiatry in, in an incredibly new and different way, and very exciting too.
Yes. Yeah.
Because if you can find other etiologies than just because your mother, was too mean to you, you've got a lot more places to intervene and help,
Absolutely. Yep.
which is amazing.
Yep. Yeah. I mean, I kind of have this theory that and I don't think, I mean, this is real. It is what it is. Like psychiatry, I think I've always been like the dumping
Oh
grounds
yeah.
for
Well,
conditions that nobody could explain,
right.
right? Um and then you see like over time, you know, like epilepsy used to be considered a psychiatric condition, right? A long time ago. And it's like over time, you see these conditions, like all of a sudden they find out a cause and it's removed from our scope of practice and put somewhere else. And so you think like, I look at these psychiatric conditions and I'm like, these are probably almost all caused by some kind of biological force
That's
underneath,
right. I'm with
and
you.
it's just that we don't know what it is yet.
Absolutely. Absolutely.
Um, I have, you know, now that I actually am exposed to pans and pandas because I wasn't for a long time. Or, when I was in training, we were told it was kind of
Right.
BS, right?
Right.
Like made up. Okay.
Absolutely.
And it wasn't until I had it staring me in the face in my own home that I could no longer deny it. And so now I've been on this journey of like completely changing the way I think about every kid I treat, and looking for other causes. And so I'm going to like close it out by telling this story because I think it's so telling. I had this patient probably about 7 years ago,
Mm-hmm.
and she was 13, and her family was from Mexico, and she went over the Christmas holidays. She went back home to Mexico with her mom to go see family.
Mm-hmm.
And when she came back, her mom said she was a different child. She came back and she had OCD so severe that it was psychotic. It was, I looked at her and I was like, this is schizophrenia, and she's so young
Mm-hmm.
for me to diagnose her. I almost never diagnosed a 13-year-old with schizophrenia, but I was like, it has like all the classic marks of schizophrenia, and it had a very strong OCD component. And poor thing ended up in psychiatric hospital after psychiatric hospital on so many antipsychotics. And finally did get stable, but after a few years decided she didn't want to be on medicine anymore, got off of medicine, has never been on it again, and is a completely normal child.
Mm-hmm.
And now I look back and I'm like, I bet she had
Oh yeah.
pans or panda. I bet she had it. And I just didn't know at the time.
Oh no,
Um,
absolutely. Absolutely. I remember one young lady, she had mono. And I guess it was a week after, and suddenly she looked clearly bipolar. And I knew it was a biologically induced problem.
Yeah.
But nobody could understand it or help me with it. I mean, she wound up being treated in the psychiatric hospital with regular psychiatric meds and did okay then. I don't know how it went afterwards. But it's just all these kids now that I think
Yep.
back on. And that kid was like 1984.
Yeah.
And I just remember saying, I know she looks bipolar, but it must be connected to that mono. It must be.
Yep. Yep.
And now it makes more sense with the immune dysfunction. But we're really, science moves very fast and slowly.
Yeah.
So, right now, immunology and inflammation. Inflammation is the key word. Everything under the sun is caused by inflammation. Mm-hmm. Or so it seems.
Right.
And I say that in a joke, and yet in a way, I'm trying to make fun of the fact that we are narrow-minded when we think about inflammation and don't think about what possibly caused the inflammation. Yep. That's not our answer. Mm-hmm. Okay? There's more behind that, and we need to be able to look at that and figure that out.
Yep. Yeah. I mean, I hope that, more doctors are going to start opening their eyes and, it's like, I think part of it is a test in humility, like saying, okay, maybe we were wrong about some things, or we need to admit that we don't know everything. And there's things we don't understand, and we have to keep learning as doctors. We always have to keep learning, so I'm hoping, now that we have like these podcasts out here and more people are talking about it, there's more awareness. I'm hoping that more doctors are going to realize, like, okay, I can no longer keep my head in the sand. I have to, start asking these questions.
Right. And remember, the body is really, the head is attached to the rest of the body.
Yep. It is not separate. As much as, the doctors from other specialties, they don't want to deal with psychiatry. They don't want to see psychiatric patients. It's like, you can't say that anymore, because it's all connected.
There's no question. There's no question. And to just refer out is really kind of missing the scientific excitement that exists in all these different ways that your body makes changes and does things.
Yep, absolutely.
So,
well, I really appreciate you talking with me and letting me pick your brain.
Oh my.
And if, for anyone, if you have not listened to the Demystifying Pans and Pandas podcast, please, and you have, a kid that has it, or a kid that has it, please go listen to that podcast. It's so informative, and you can find Dr. Greenberg's episode on there. It was a really, really good one to listen to. So thank you, Dr. Greenberg, for speaking with me.
Thank you.
Thank you for tuning in to this episode of the Little Brain Campaign podcast. If you've been enjoying our show, give us a follow on your favorite podcast platform so you never miss an episode. If you know someone else who would enjoy this conversation, please take a minute to share this episode with them and help grow our audience. See you next time.